Good afternoon. As of today, the city has 11,003 reported cases, 193 people hospitalized with COVID-19, and 380 deaths. I'm up here every week to ensure our residents have the most up-to-date and accurate information so they, in turn, can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise right here in the city of Baltimore. I want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov. That's coronavirus.baltimorecity.gov. There, residents can find real-time data for Baltimore City as well as locations for where they can get tested. Last week, I reinstated restrictions on indoor bars and restaurants, and the Health Commissioner issued a public health order requiring all residents over the age of 2 to wear a mask when in public and unable to socially distance. And I keep seeing people complaining about masks and asking for exceptions to be made. Let me be clear. COVID is not making exceptions. We all need to be asking about how we can better protect our family, friends, and neighbors. We need all of our residents to commit to wearing face covering instead of trying to find loopholes to avoid something the World Health Organization, the CDC, the Maryland Department of Health, and the Baltimore City Health Department are all saying we need to do in order to stop this disease. According to the recent data, we are moving back to where we were quickly despite our best efforts. We really need everyone to do their part. Again, that means everyone wearing a mask in public when you are unable to socially distance. Social distancing and setting with other people and continuing to wash your hands in high touch point areas often. Baltimore is different from our surrounding jurisdiction. It's a densely populated urban city, and that presents its own set of challenges. Now is the time to set Baltimore apart in our response. And as a city, say we aren't afraid to be trailblazers that stand alone when it comes to protecting our residents. Again, I want to thank the majority of Baltimoreans who have heeded the warning and followed the guidance. And as always, we will continue to monitor the data daily. Now I will ask Baltimore City Health Commissioner Letitia Zarasa to update you on our COVID response and how we are supporting residents and their families in our city.
Thank you, Mayor Young, for your leadership and your willingness to make the tough decisions that protect the health and wellness of Baltimore City residents. 1 week ago, we addressed city residents about the difficult but necessary orders to restrict indoor dining at bars and restaurants. Additionally, at that time, I issued a health order that now requires face coverings be worn in all public places where social distancing isn't possible. As I indicated last week and will reiterate this week, our case data supported the necessity of these orders. We saw an increase in new cases above what would be expected for our increase in testing alone, and more specifically, we saw an increase in positivity rates and an increase in cases among young people. A week later, our data continues to show the same alarming trends. As of today, our July peak 7-day average number of cases is 137. At our previous peak in May, it was 124. On July 24th, the 7-day average for new cases per day was 126. In comparison, on July 5th, it was 67. Additionally, on July 24th, the positivity rate was 6.4%. It was 5.1% on July 5th. These are all significant increases that are not merely due to an increase in testing. A few weeks ago, we began to see a divergence in Baltimore City's positivity rates, which has been greater than the state's overall. According to state data, as of July 28th, the city's positivity rate was 6.2%. This is 1.4 percentage points higher than the state's at 4.8%. In other words, Baltimore City's positivity rate is 29% higher than the overall Maryland positivity rate. So despite testing volume increases across the entire state, including here in the city, Maryland's positivity rate has remained steady while ours is increasing. All of these data are indicative of the resurgence of new cases in Baltimore, a trend confirmed by the latest White House Coronavirus Task Force report released just this week. While the rest of Maryland may be holding steady according to this White House report, Baltimore City is in the yellow zone. This means that Baltimore is one of a handful of jurisdictions seeing the early signs of a new surge of cases. Recommendations to address the rise in cases include non-pharmaceutical interventions like the restriction of indoor dining and mandatory masking. The vast majority of you are heeding our pleas to continue to practice social distancing and wear your face coverings, but the case data indicates that not enough of us are. Many of the questions we received online this week around the face covering order involve businesses and individuals trying to come up with creative solutions around wearing face coverings. Put simply, if you are outside of your home, keep a face covering somewhere on you at all times. If you are close enough to say hello to someone else while you're out, you should be wearing a face covering. So again, wear your mask anytime you're in public around other people that aren't in your household and you can't socially distance. As your health commissioner, as a pediatrician, and as a mother, these trends raise serious concerns about the health of our entire community. While there are parts of the pandemic that we have no control over, every single person without contraindicated health conditions can wear a mask and make efforts to keep their distance from individuals outside of their household. The recent case data and positivity rates indicate that segments of our population may not be paying attention, or worse, people are not taking COVID as seriously as they should. As a city, we are losing 2 to 3 people a day to this disease. And if these trends don't reverse, that number could go up. Because of the nature of this disease, these people are dying alone, with no friends or family at their bedside, with no one holding their hands in those last few moments of their lives, and with no options for families who want to say goodbye to their loved ones in person. This disease is real, and it's dangerous to believe that you are immune or untouchable as it relates to COVID. We all have our part to play to keep our community healthy. There is absolutely nothing political about wearing a mask. It helps protect you and those around you. We are making every effort to keep Baltimore safe and healthy and to slow the spread of COVID-19. But without the help of businesses, individuals, and a coordinated response, that task is proven to be more difficult. Now, right before this press conference, I learned that Dr. Gregory Branch, the health officer for the Baltimore County Health Department, was diagnosed with the coronavirus. While the data is certainly important and it drives our decision, Dr. Branch's illness and the illness of so many Maryland residents are not just numbers on our dashboards. They are real people whose illnesses are affecting their lives and the lives of their loved ones. I'd like to wish Dr. Branch and all of those Maryland residents who've taken ill to coronavirus a very speedy recovery. This serves as an unfortunate reminder that none of us are immune. So I urge you, please continue to stay home, avoid large gatherings or crowds, wash your hands frequently, practice social distancing when you're out, and wear your face covering over your nose and your mouth. Thank you.
Thank you, Dr. Zavasa. Next, I want to talk a moment to make an appeal to Congress, not on behalf of my city, but on behalf of all local governments. Right now, on Capitol Hill, lawmakers are negotiating the next stimulus package. Meanwhile, American cities, towns, and villages are facing a double whammy. Mounting expenses related to the pandemic, while tax revenues are declining. America's communities are hurting, not just mine, but cities and towns across the country. The bipartisan decision to shut down the nation's economy has exhausted the budget of cities of all shapes and sizes, urban and rural, and of all political stripes. An analysis by the National League of Cities finds that municipalities across the country are facing over $360 billion in lost revenue over the next 3 years due to the impact of COVID-19 pandemic on local economies. Our way through this crisis is tied in true method, partnership, unity, and trust, a truly united effort between state, federal, local leaders, and America's residents. Direct federal assistance to local government is one of the most effective ways to limit the economic fallout from the pandemic emergency. According to the Congressional Budget Office, federal spending on local government assistance would have an even greater economic impact, dollar for dollar, than businesses' tax provision and refundable tax credit. Without federal assistance to address the unanticipated consequences of extraordinary measures to contain the spread of COVID-19, dire circumstances will force many local governments to lay off thousands of critical workers and cancel infrastructure projects and capital expenditures. Local governments, not including the school system, have been hit much harder and faster than during the Great Recession. From 2008 to 2012, local governments lost 588,000 jobs, or 4% of their total. Since February 2020, local governments have lost 1.3 million jobs, or 9% of their total, more than double the job losses of the Great Recession. Local governments have also not bounced back from these losses as state and regions began to reopen. Municipal budget cuts will directly harm local, regional, and national economies. The Congressional Budget Office estimates that projected cuts to state and local purchase of goods and services from the private sector amounted to $350 billion in 2021 and 2020, making up 9% of the total decline in GDP. So what we are asking for on the local level is $500 billion in direct, flexible spending to each and every local government. Over the next 2 or more years, about $125 billion per year to municipalities. No population threshold for eligible funding, and a fair and equitable allocation of funding to each and every local government at levels appropriate to their needs and with minimal additional burdens to the states. This is achievable without creating an entirely new administrative or regulatory framework, by simply modifying the formula used to distribute the Community Development Block Grant, or CDBG. This formula considers population alongside measures of poverty and housing instability, and it includes a set-aside for thousands of small and rural municipalities below 50,000 residents. Eligible expenditures should address a broad range of purpose, including public health, economic recovery, emergency payment on behalf of jeopardized residents, municipal budget revenue shortfalls as a result of closures due to COVID, and technical assistance to those in. Thank you for allowing me a moment to make this plea to Congress. Next, we will talk about the recent flooding and resources available to residents during and after the event. Last week, we had a pretty bad storm, and flooding followed in several areas of the city. Today, I have asked the Office of Emergency Management, Department of Public Works, Department of Transportation, and BGE to join me to provide residents with invaluable information and resources available during and after a flood event. First, we have Chief Surveyor from the Office of Emergency Management, who is coming, and then he will introduce all of the speakers. Thank you. How about that? Good enough?
Thank you, sir. Thank you, Mr. Mayor. Last week on Wednesday, July 22nd, and Friday, July 24th, we had 2 late afternoon thunderstorms with heavy rainfall that resulted in some local flooding in the area. There were a total of 42 calls for stranded motorists, 17 on July 22nd, the Wednesday, and 25 on Friday, the 24th. Some of those calls were duplicates for the same incident, depending on the address given by the callers. No actual rescues were required, but rather the Baltimore City Fire Department assisting the stranded motorists to a safe area was what was required. This time of the year, the city is susceptible to having these late afternoon thunderstorms that produce heavy rains. Mayor's Office of Emergency Management is always in contact with the National Weather Service in Sterling, Virginia. And when we receive severe weather threats, we immediately push them out through our social media accounts. When we are aware a storm is possible, we monitor the areas around the Jones Falls, Gwynns Falls, Herring Run in case of flooding. Also, with the help of the fire department, we monitor, and other agencies, we monitor some of our known trouble spots, such as Pulaski Highway, Monument Street, North Point Road, Kane Street underneath the train tracks, the lower areas of Fells Point, Meadow Mills, and Kelly Avenue, the little bridge that leads back into where the Whole Foods is. And of course, the Frederick Avenue corridor where we were just out on July 18th doing a flood awareness initiative with the residents in that area. The public should be reminded that driving through a flooded roadway, even if caught unexpectedly, can present dangers for yourself and others. If you encounter floodwaters or standing water, turn around and seek another route. This is not the road you know, no matter how many times you've driven it. Just 6 inches of moving water can knock you down, and 1 to 2 feet of moving water can sweep away a passenger vehicle. Situational awareness is key for all of our residents to practice their safety. With that, I'm going to turn it over to Matt Garbark from Department of Public Works. Thank you.
Thank you, Chief Cervela. My name is Matt Garbark. I'm the Acting Director of the Department of Public Works. Last week, the 2 storms that were mentioned, each of them independently dumped nearly 2 inches of rain on the region in less than 1 hour. Because our climate is changing, we are seeing more storms, and we are seeing more severe and erratic storms. What happens is some areas of the city get deluged with 2-3 inches of rainwater, while just a few miles away, another area gets very little, and only a couple weeks later, that could be completely opposite. So when these storms come through, they can create a large issue very quickly. There are a few things that we ask residents to do and that the Department of Public Works does as well. First, we encourage residents, as Chief Cervela said, to have situational awareness, and we ask them to look at the storm drains surrounding their community. We don't ask them to go very far, just look for what's right around their home and see if it is clogged with trash or debris. A lot of this, the backups that occur, are because our storm drains are clogged with trash or debris. If someone can remove it on site, go ahead and remove it. If it is difficult, if it requires some more expertise to do that, we ask everyone to please call 311, and our utility maintenance crews will go out to clean the storm drain and remove the trash. We ask everyone to please refrain from littering, refrain from throwing anything in the street. What ends up happening is this gets washed into the storm drain because the storm drains are located in specific areas that allow the water to drain, that can push trash and other debris into that storm drain, which then clogs it up and can create flooding. Think about an hourglass with sand. The more narrow the constriction, the longer it takes to drain. That's the same thing with our storm drains. Even a small blockage, even a small thing can restrict it and can cause flooding to increase and become much more difficult. The other issue that happens is because we have aging infrastructure, the amount of rain and the flooding can allow for rainwater to enter our sanitary sewer. The sanitary sewer is what conveys sewage to our treatment plants. If rainwater gets in there, it can quickly overwhelm the sewer system, which can cause backups. These backups go into people's basements. What we are asking is for people, if their basement backs up with sewage, to avoid that area. It is very dangerous. There are bacteria and other contaminants down there that can cause serious health issues. If your basement is flooding, call 311 immediately. We get a utility maintenance person out there within 2 hours, if not quicker. It is a priority of ours to go there, to address it, and to look at what the issue is. Understanding and preventing sewage backups, handling sewage backups, and sewage backup reimbursement programs are all things that we've developed thorough pamphlets and brochures on, and we have them on our website and have made them widely available to people. We continue to go to community meetings and other areas and provide this information out to people. So please, we're asking people to remember to call 311 immediately. That lets us get out there as quickly as we can to address the situation and move forward. And with that, I'd like to now introduce the Director of Transportation, Mr. Steve Sharkey.
Good afternoon, everybody. Steve Sharkey, Baltimore City DOT. Just wanted to talk just for a minute or two today about some flood safety from the DOT perspective. So definitely prior to any large storm that is well known or well forecasted, we'll frequently get ready and very much come to the areas that are the hotspot areas, and also sometimes even request or remove vehicles from Fells Point or Harbor East or some other coastal flooding areas. That is different than some of these recent storms as well, which have been much more fast-moving and localized in other areas. But again, we will be putting parking restriction in low-lying areas when we know this is coming. We also want people to be aware that the road can also become slippery. Now, I know that's very simple to think, but really remember, as the rain and the water goes up, or even up to an inch, the road very much becomes slippery. People have to slow down every day. If it rains, you really need to slow down while driving to continue to safety. Also, when large storms hit, traffic signals will frequently be out of power. We want you to remember that when a traffic signal is out, to treat it as a four-way stop. That is, when you were 16, that's how driver training taught you. But please remember, stop at the intersection, look at the other vehicles coming, and make sure that it's safe to cross. We also want to remind you to call 311 for any of those that are out, so that we can come and address them as quick as possible. So we also work with BGE to restore powers to traffic signals and lights, and we also ask that you continue to call 311 for both traffic signals and street lights that are out. I'd also like to just remind you about pedestrian safety. Make sure that you're not walking down flooded streets. You're watching where you're going. When it rains this much, it becomes more dangerous, especially for pedestrians. You can also come and receive, or you can also sign up for some email or text messages, which will frequently talk about closures, road closures in an area. And you should also, of course, tune to your local media channels. Now I'd like to invite BGE External Affairs Manager Emmanuel Moore.
Good afternoon, everyone. My name is Emmanuel Moore. I'm the manager for External Affairs for Baltimore Gas and Electric. Want to provide some tips today and remind our customers about some of the hazards that could occur during flooding, storms, things of that nature. But before I get started, I just wanted to say again, thank you, Mr. Mayor, and your administration for your leadership during this unprecedented times. We are very proud, and we are continuing to be a strong partner to Baltimore City. Like everyone here, BGE has been navigating its way through very challenging times, keeping safety of our employees, contractors, and customers in the forefront of everything we do. As a supporter of first responders, BGE crews are often on the front lines alongside Baltimore City personnel when flooding and other emergencies occur. Whenever storms cause coastal surges and heavy rainfall, there's a possibility of flooding to areas near the Chesapeake Bay and its tributaries, including the Inner Harbor, Canton, and Fells Point, but also to areas like inland, North Baltimore, as we saw recently. As floodwaters arise, it raises the potential for water to penetrate the natural gas system in low-lying portions of BGE service area. This could cause gas outages, and particularly in a time such as the pandemic when we need hot water to help with sanitation and cleanliness, it could be very troublesome. Additionally, heavy rainwaters and rushing water can damage underground electric cables, causing power outages. And there could be times when overhead power lines are knocked down during a storm because of submerged water, particularly around trees whose root systems become weak and they tend to blow over with high winds, compromising the electric distribution system. BGE stands ready to address these types of emergencies every day. We have an emergency response plan in place. We hold frequent drills to ensure employees are ready to carry out their storm assignments. and we want our customers to know how to respond when flooding or any kind of storm damage occurs, particularly around gas and electric equipment. First and foremost, as we often repeat, never go near a downed wire and warn others to stay away. Always assume it's live and call BGE immediately. Even if you're not sure whether it's an electric cable or telecommunications wire, we encourage you to contact us. You can always do that at 1-800-685-0123. BGE will respond, will make the area safe, and restore service as soon as possible. Secondly, during heavy flooding, it's also possible for water to get into gas and electric meters. If this happens, again, call BGE at our 800 number, and we will respond, assess the situation, and replace the meter and other BGE equipment if necessary. This may require an interruption to power, both gas and electric, but our technicians are sensitive to everyone needing their services, particularly at this time, and we will work to restore service as safely and as quickly as possible. The most important thing to remember is to avoid flooded areas, especially where gas and electric equipment is present. There could be power lines underneath the water, and we want to make sure that our customers and Baltimore City residents stay safe. As always, you can call BGE right away if you see damaged equipment. The safety of our customers, employees, and contractors is always our top priority. Thank you.
Thank you all for joining me today and sharing that important information with our residents. Next, I want to talk about another issue that has arisen during the COVID-19 pandemic, an increase in domestic violence. On a national level, domestic violence cases are on the rise since COVID-19 and the stay-at-home orders went into effect, and that caused me great concerns. I have therefore asked my team to look into the impact of COVID-19 on this issue here in Baltimore. And I have invited Amanda Rodriguez, Executive Director from Turnaround, Inc., to speak to some trends we are seeing.
To start by saying thank you to Mayor Young and for the Mayor's Office of Criminal Justice for inviting me here today. As you said, I'm the Executive Director of Turnaround. We are a crisis response and comprehensive victim service agency for survivors of domestic violence, sexual violence, and human trafficking here in the Baltimore metro region. In order to do the work that we do, we have a number of services that have been impacted as a result of COVID-19. We have a 24/7 hotline that ensures that survivors can access emergency services whenever they need them. That hotline is also available to our law enforcement partners, hospitals, and other local service agencies so they can reach us whenever they need us support. We have emergency shelter for survivors who are fleeing violence and are in imminent danger. We provide trauma-focused individual and group counseling to survivors and their non-abusive partners and family members. We have court advocacy and provide case management that focuses on empowering clients towards their journey towards self-sufficiency. All of these services are free, available to the public free of charge, and also are available to every gender identity, sexual identity, orientation, and age group. Nearly half of the services that we provide are to those that are racial or ethnic minorities, and approximately 40% report having no income or receiving public benefits. Through this work, we serve over 2,000 individuals a year through direct service. Our agency also impacts our community through our community engagement team. This team provides awareness and training to members of our community in hopes of preventing future violence. This includes schools from elementary all the way up to colleges, and also to local community serving agencies like law enforcement and the judicial system. Just like many others, we had to make a swift and significant shift when schools closed back in March. We adapted all of our services during those first few weeks to meet the needs of our community. We noticed in the first week that the number of survivors who were reaching out to us had dropped significantly. We were concerned that folks did not know that we were still open and available. Our wonderful community engagement team rallied and pivoted all of their work towards social media outreach. They're given reach in a year when it's not COVID-19, is between 8,000 and 10,000 individuals that receive in-person training and support. Our reach on social media as of April was 15,000 per month and has increased every month since then. By April, our numbers across the board were not just normalizing in terms of those seeking services, but were also substantially higher than we anticipated based on previous periods. To date, compared to the prior 6-month period, our monthly call volume is up 300% of those seeking services. Our call volume for emergency shelter is over 200%. From community members seeking therapy services, it's up 138%. And our calls from community members seeking emergency assistance is up 150%. We then looked at enrollments because we were concerned that those individuals who are living with their abuser may be increasing in terms of their domestic violence that they were experiencing. We did see that disproportionately domestic violence survivors were reaching out more, and based on the increase overall in numbers, we did find that, in fact, we were serving a lot more domestic violence survivors as a result of COVID-19. Another interesting statistic is that we saw an increase of over 10% of those having multiple victimizations, so across the board in terms of victimizations. So it may be that individuals are having a difficult time coping with the trauma of COVID-19 in addition to maybe some of the other victimizations that they had experienced. As I stated before, emergency shelter increased over 2,000% in the last 6-month period. Because so few other housing resources were available for the populations that we served, this led to much longer stays for individuals in our emergency shelter. On average, it's about 48 to 72 hours. Through COVID-19, April, May, and June, we were seeing around 2-month stays. An example of our budget for an entire fiscal year for emergency shelter is about $30,000. From April and to date, we've spent over $60,000 on emergency shelter support, and we also provided food and transportation for those survivors of over $10,000. We've sheltered 56 families and at 659 bed nights. Even through the pandemic, we successfully moved almost all of those clients into safer and long-term housing. One particular client actually reached out to us via that direct social media outreach. And she was communicating with our social media team in order to ensure that she could reach out because the issue was that she was living with her abuser, who was abusive to both her and her young child. She had very few windows when she could seek help, and so social media was a perfect outreach method for her. Eventually, she did have a safe window, and she was able to reach out via that 24/7 helpline. And when she did so, we were ready to provide transportation to our emergency shelter. She was seen by a therapist virtually, safety planned with an advocate, was able to connect with legal services within a week. She stayed with us for just a few weeks and then moved to an out-of-state placement with a family member. She's safe now and continues her legal case. But her story really highlights the impact of what we do, why we do it, and how we do this work through the pandemic. Turnaround is known for showing up, and we take that responsibility to our community and to our clients very seriously. We continued and will continue to be there for those who need us and for Baltimore. If you or a loved one is suffering from abuse, or if you are suffering as a result of the trauma of COVID-19 from previous instances of abuse, we can help. So please call our 24/7 helpline at 443-279-0379. If you would like to volunteer and become a team member at Turnaround, if you want to bring an awareness event to your community, if you want to support us at one of our fundraisers that are coming up to support that dramatic increase in the cost of housing individuals through COVID-19, we have a fundraiser actually coming up next week. All of that information is available online on our website at turnaroundinc.org. We are also very active, as I said, on Facebook and Instagram, and would love you to become a team member by engaging with us there. We want you to be a part of our team and part of the solution to end intimate partner violence, sexual violence, and human trafficking here in Baltimore. Together, we can make a difference. So please reach out and support. Thank you.
Thank you, Amanda, and thank you for the great work Turnaround does in Baltimore City. My administration and I recognize that COVID-19 and social distancing may present additional risk factors for victims and survivors. And while it's important that we work together to avoid the spread of the virus, you are not required to stay at home when home is not safe. It's important to note that people who are lesbian, gay, bisexual, transgender, and/or queer experience intimate partner violence at similar and sometimes even greater rates compared to heterosexual people. According to the CDC, nearly 44% of lesbian women and 61% of bisexual women have experienced rape, physical violence, and/or stalking by an intimate partner, compared to 35% of heterosexual women. 26% of gay men and 37% of bisexual men have experienced similar violence, compared to 29% of heterosexual men. African Americans are more likely to experience intimate partner violence. The intersection of gender, sexual orientation, and race create a unique situation for LGBTQ people who are also Black. Any work on intimate partner violence must include the experience of LGBTQ people, especially Black LGBTQ people. I'm asking everyone to help spread the word. If you know someone you know is not safe, please call or text 911 immediately. You may also visit our City Hall website and social media platforms for information on local service providers such as Turnaround Inc. or the National Domestic Violence and National Human Trafficking Hotlines. My administration also remains available for assistance, and we will continue to do our part in partnership with law enforcement to ensure that those who use violence of any sort are held accountable for their action. And finally, today, before I open it up for questions, I would be remiss if I didn't acknowledge that tomorrow is Baltimore's 291st birthday. So let me be the first to say happy birthday, Baltimore City. At this time, we'll take a few questions.
Mayor, you described a pretty significant increase in the positivity rate for the COVID tests. What kind of increase would you need to see to implement more restrictions on the city's residents?
Well, I'm going to let my health commissioner answer that.
So if you can go to our website, coronavirus.baltimorecity.gov, we do have our reopening indicators listed on there. Specifically, we have new cases. We'd like to see a decline for a number of days, which we're not seeing. We'd also like to see a decline overall in the number of deaths, which we aren't seeing. But we're also looking at hospital utilization, overall testing capacity in the city, and all of those things together. I would make recommendations to Mayor Young. As noted, the current restrictions on indoor dining were at least through August 7th. So I would imagine that early next week we'll be reevaluating the data, and I'll be making a recommendation.
And I had a quick question about the governor has said repeatedly that the rise in cases is due to more testing. Is that true here in Baltimore?
So as I mentioned, there's been increased testing really across the entire state, but if you look at our positivity rate compared to the rest of the state, it's increasing, and there's a divergence where the rest of the state is remaining relatively steady. So I believe that it's related to a surge in new cases.
You've been experiencing a heat wave here recently. What are you doing within the city's cooling centers to ensure that people are not spreading the coronavirus there?
Y'all want me just to let us stay here?
So prior to opening our cooling centers, we worked with all of our CAPs and our partners to ensure that appropriate measures were put in place to allow for social distancing for any residents who come to the cooling centers. We also work with our partners at DGS to ensure appropriate cleaning of all of our cooling centers before and after use.
Mayor, this is probably for you. I spoke to a restaurant owner today who described the difficulty with masks. And
With what now?
With enforcing the mask order. And as she put it, being the mask police. Is this really what this has to be? And now there's, more stringent order going into effect tomorrow. Is that it's up to individual businesses to be the enforcer?
I think if they want to keep their businesses open, they need to follow the rules and regulations that were set forth by this administration and our health professionals, which requires masks and social distancing. If they don't adhere to that, they will be closed.
I have just one more question. Dr. Birx had said last week she was concerned about the rise in cases in Baltimore. Since those comments became public, have you gotten any offer of any extra federal help? Have they reached out to you to see what they can do?
So I was able to get on a call with Dr. Birx earlier this week. We were invited to participate in a call with some other jurisdictions that had been identified, and we did walk through some of the recommendations from the federal partners, but we have not necessarily received additional support, just additional recommendations.
Sounds like during all of this, we've fallen behind a little bit on the census numbers coming in from Baltimore. Can you just kind of reiterate why that's so important and what that means for the city to get those turned in?
Yeah, thank you. It is very important that every resident of Baltimore City fill out their census forms. That's $1,800 per person, and over a 10-year period, that's $18,000 that we lose. And as a city, we can't not afford not to be able to get the federal money that we need to do all the things that we're doing right now. So I encourage everybody, you're home, fill out the forms. It takes 10 minutes to do. And it also decide how much representation we get. We can lose a congressional district. We can lose legislative districts. So it's important for us to be counted. And I know that Baltimore will get it done. So I'm asking everyone to continue to fill out the census forms. If you need help, you can call the city. We'll do everything we can to help. Our libraries have computers, and I know they're open on certain days. So there's no need for anyone not to fill out the census form. Plus, the census taker, if you don't fill it out, will be knocking on your doors. So please make sure you do everything that you can to be counted. Thank you.